In a recent video, I discussed 6 things that I would not do to control diarrhea from irritable bowel syndrome. And in this video, I'm going to discuss 6 more mistakes to avoid. First, I would not haphazardly reintroduce foods when you're pursuing a FODMAP diet. I don't want you to just add all the foods in all at once, and also don't want you to have a huge amount of one of your potential triggers on the first day. You need to think of food as medication, and it has side effects. And so if you have a huge dose the first day and all of those foods at the same time, you're not really going to be sure what triggered your actual symptom. So I want you to be purposeful about this. Keep a diary, a spreadsheet, however it is that you need to be to stay organized. Start with a small amount of food, and just because you tolerate that first meal, don't presume that you're in the clear. Give yourself a couple of days. The GI tract moves slowly and it responds to things slowly. After a couple of days, you can increase the dose, and by the end of the week, you'll know what the appropriate dose is for that food. Next, I would not be overly focused on gluten sensitivity as a trigger of your irritable bowel syndrome if you've had negative celiac studies. There's been a lot of interest in non-celiac gluten sensitivity. These are patients who had negative celiac studies, but they appreciate a lot of symptom improvement when they exclude gluten from their diet. However, a lot of evidence shows that irritable bowel syndrome may be more triggered by fructans. Fructans happen to be in bread, gluten's in bread, and so that really confuses the picture. So how to clear that up? Sourdough bread is actually low in fructans, but of course it still has gluten. So if you can tolerate some slow rise, slow fermentation sourdough bread, then you probably are not gluten sensitive, but fructan sensitive. I would not eat too quickly. Doing so means that you're swallowing a lot of air, you're not chewing up your food well, and that's going to make you very bloated. If you don't burp all that air out, you're farting it out the next day. Chewing is so important for a patient with irritable bowel syndrome because it's really unappreciated first step of your digestion. Not only do our teeth help to grind up food so that it's easier to digest in the stomach, but your saliva is the first step in enzymatically breaking down carbohydrates, especially complex carbohydrates. We don't give this step of digestion enough credit until we consider that your food is going to sit in your stomach for hours after you've swallowed it. So you want it to not be a wasted time. Make full use of your mouth. Get your food chewed up and get the saliva mixed in so you can have a strong kickoff to your digestion. This next one may surprise you. I would not eat too much fresh fruit. Why? Fresh fruit's got so many health benefits, but too much of a good thing is still too much of a good thing. Fruit also has some sugars that can be difficult to digest for a person with irritable bowel syndrome. Those include fructose and sorbitol, and it's different for different fruits. So I would limit this to 3 servings. But what is a serving? It's about a fistful. So that's half a grapefruit, a full orange, or a handful of cherries. Another one that's going to surprise you, GI doctors are always saying have more fiber, but I'm going to tell you don't have too much fiber, and be careful what type of fiber you're having. Some supplements use inulin, which can cause a lot of bloating. Studies have shown on MRIs that the colon can distend wildly when you're having too much inulin. So be careful of what type of fiber supplement you're using. But what about foods? These also can cause problems. Kale, broccoli, some of these are difficult to digest, but think about how you're preparing it as well. If you cook it, I think you're going to find it a little bit easier to eat than if it was raw. But also be mindful of the sauces that you're adding to it. Don't drown it in a salty, umami-rich sauce. Those are just going to sit in your stomach and they're going to cause their own set of symptoms. You're going to be burping it up the next day and think that for breakfast you had last night's dinner. And that brings me to my final mistake to avoid for this video, and that is to be careful with peppermint. Peppermint has been used as a way to soothe the gut for people with IBS, but I don't want you to turn to artificially sweetened peppermints. Peppermints can be welcome relief for the bad taste of reflux, but if they have too much sorbitol in them, they're going to cause some diarrhea. I hope this information helps you to avoid common mistakes to control your irritable bowel syndrome. Please subscribe to the channel because we got a wealth of information here on other topics in IBS and general GI health. Thank you for your time and be safe.